Richmond Bone and Joint Clinic disclaimer. The video you are viewing offers instruction and advice regarding the evaluation of injuries, first aid, rehabilitation, and use of durable medical equipment. While helpful, this video is not meant to replace the sound medical advice of a trained physician. Please seek treatment and evaluation for any injury or medical condition. Welcome to RBJC.com. On this segment, we'd like to discuss concussions and head injuries. We'd like to remind you, you're not trained, you don't feel comfortable to evaluate the head injury. There's some basic things we'd like you to be aware of. The mechanism that most people are familiar with a concussion is with football. You know, helmet on helmet contact, usually in the front. But there are other ways that you can get a concussion, obviously. Any type of frontal head injury, being in the batter's box, being struck by a baseball, two basketball players colliding, two soccer players colliding. There's a lot of ways that it can happen. One thing we'd like you to remember though, if you're not comfortable in assessing the head injury, there's a couple of things that you can do. Number one, you can ask them very simple questions, such as, what day is it? Where are they at? What's the score? What's their opponent? Those are simple things. And if they look off into the distance and don't give you the answer you want, then obviously you want to hold them out. You should always refer them to a physician for evaluation and impact testing, which we'll discuss at a later segment. We'd also want you to remember that there are some aftercare that you need to be aware of too. If you have held them out and you're waiting to see how they're doing, that's acceptable practice too, but we don't want you to wait too long. Some things to consider on the ride home or at home is if they're very, very sluggish, if their answers are drawn out, they're very, very sleepy, then those are indicators that possibly you ought to go ahead and go to the ER and have them checked for a head injury. Always remember, we advise that you use good common sense regarding head injury, especially for younger children that may be anxious to return to play and may not tell you what you want to hear, but use your common sense, see how they feel, look for some additional signs such as nausea or vomiting. Those are additional symptoms that you want to check. But please remember, head injuries happen. They should be taken care of and managed properly. So we're hoping that what we gave you here will provide you some insight into a head injury and management of those head injuries. On behalf of Richmond Bone and Joint Clinic, we'd like to thank you. And always remember, please visit rbjc.com.